Hi, have a good day everyone, especially to Ma'am Gwendolyn. So today we're going to do informational or infomercial regarding the disorders or diseases related to endocrine system. So before I will move on, I will give a brief discussion or overview regarding the endocrine system. So endocrine system, as we know, that is made up of glands that produce and secrete hormones, chemical substances produced in the body that regulate the activity of cells or organs. These hormones regulate the body's growth, metabolism, such as the physical and chemical processes of the body, and sexual development and function. However, there is several disorders or diseases that related to the endocrine systems, and this results when a gland produces too much or too little of an endocrine hormone called a hormone imbalance. The endocrine feedback system helps control the balance of hormone in the bloodstream. If our body has too much or too little of a certain hormone, the feedback system signals the proper gland or glands to correct the problem. A hormone imbalance may occur if this feedback system has trouble keeping the right level of hormones in the bloodstream if our body doesn't clear them out of the bloodstream properly. So, one of the endocrine disorders that related to our endocrine system, firstly, is the gigantism. So, as we all know already, what is the gigantism? Is a serious condition that is nearly always caused by adenoma, which is a tumor of the pituitary gland. Gigantism occurs in patients who had excessive growth hormones or oversecretions of hormones in adolescence or in childhood. So, the pituitary tumor cells secrete too much growth hormone, leading to many changes in the body. The main symptoms associated with gigantism is large body stature with increased height compared to peers. Muscles and organs may enlarge as well. So the other symptoms of the gigantism include the delay in puberty, enlargement of heads and feet, physical changes in similar to patients with acromegaly. So the gigantism and acromegaly is almost similar, but which is gigantism occurs in the adolescents, while the acromegaly is occurs in the adulthood people. So, um, next is the abnormal enlargement of the hands and feet, widening of distal fingers and toes, called the paddle toes. Hands feel like a soft broth dough, and then changes in facial features, which can be quite prominent, enlarged forehead and jaw, pronounced underbite, and spreading teeth, enlarged tongue, nose, and lips. Deepening also of the voice in males, skin changes, increased number of skin tags, oily skin, excessive sweating, increased tissue in the wrist can lead to nerve compression, which may cause carpal tunnel syndrome, arthritis, and headache. So that's all about of the gigantism. So now let's proceed to acromegaly. So acromegaly, I already mentioned a while ago, it's almost similar with the gigantism. Acromegaly is a disorder that occurs when our body makes too much growth hormone. Um, it's occurs. This one is in adults people. So too much of this hormone causes bone, cartilage, body organs, and other tissues to increase in size. Common changes in appearance include enlarged or swelling nose, ears, hands, and feet. So what are the symptoms of acromegaly? So same also in the gigantism. Firstly, hands and feet become larger and swelling. You may notice a change in a ring or shoe size, especially the shoe width. Lips, nose, and tongue become larger. Bone changes, brow and lower jaw jut out. Bridge of the nose gets bigger and space between teeth increases. Skin becomes thick, coarse, and oily. Sweating and skin odor increase. Voice becomes deeper. Skin tags small, usually flesh-colored growth of skin that have raised surface, make it larger or darker. And then the next one is the pronatism, elongation and widening of the mandible. So that's for acromegaly. And the third one is dwarfism. So it's a short stature that results from a genetic or medical condition. Dwarfism is generally defined as an adult height or estimated of 4 feet or 4 feet and 10 inches or 147 centimeter or less. The average adult height among people with dwarfism is 4 feet or 122 centimeter. Some people prefer to term or short stature or little people rather than dwarf or dwarfism. So it's important to be sensitive to the preferences of someone who has these disorders. Short stature disorders do not include familial. Short stature, short heights that's considered a normal variation with normal bone development. So the disorder usually results in the following. First, short arms and legs, with particularly short upper arms and upper legs. Short fingers, often with a wide separation between the middle and ring fingers. Limited mobility at the elbows. Disproportionately large head with a prominent forehead and flattened bridge of the nose. Progressive development of swayed lower back. Progressive development of bowed legs. An adult height around 4 feet or 122 centimeter. Small genitalia and delicate extremities. So these are only the several disorders or diseases related to our endocrine system. So now I will give to the floor to my partner to further discuss about the disorders or diseases related to the endocrine system. So I will give to the next person who will discuss these disorders. So thank you and have a great day.
So, thank you for that wonderful and clear explanation, partner. So, now we will discuss about the other possible disorders in endocrine system.
Hypoparathyroidism is an uncommon condition in which your body produces abnormally low level of parathyroid hormones or PTH. PTH is the key to regulating and maintaining a balance of two minerals in your body, calcium and the phosphorus. Signs and symptoms of hypoparathyroidism can include tingling of burning in your fingertips, toes, and lips, muscle aches or cramps in your leg, feet, stomach, or face, twitching or spasms of your muscles, particularly around your mouth, but also in your hands, arms, and throat, fatigue or weaknesses, painful menstrual periods, patchy hair loss, dry coarse skin, brittle nails, and depression or anxiety. So, if you have signs or symptoms associated with hypothyroidism, see your doctor for an evaluation. Contact your doctor immediately if you have seizure or have difficult breathing. This can both complicate of hypoparathyroidism. Hypoparathyroidism occurs when your parathyroid glands don't secrete enough parathyroid hormones. You have four small parathyroid glands in your neck behind your thyroid gland. Factors that can cause hypoparathyroidism includes neck surgery. This most common causes of hypoparathyroidism develops after accidental damage to or removal of the parathyroid glands during surgery Neck surgery may be done to treat condition of the thyroid gland or the treat throat or neck cancer.
Autoimmune disease. In some cases, your immune system attacks parathyroid tissues as if they are foreign bodies. In the process, the parathyroid glands stop producing their hormones. Then, hereditary hypoparathyroidism. In this form, either you're born without parathyroid glands or they don't work properly. Some types of hereditary hypoparathyroidism are associated with deficiencies of other hormone producing glands. How to prevent hypoparathyroidism? There are no specific actions to prevent hypoparathyroidism. However, if you're scheduled to have a thyroid or neck surgery, talk to your surgeon about the risk of damage to parathyroid glands during the procedure. Your doctor may choose to test your calcium, parathyroid hormones, and vitamin D levels, or have begun supplementary if needed before surgery. The next disease that we will discuss is the hyperthyroidism. Hyperthyroidism is the condition in which your thyroid creates and releases more hormones than you need. This is also called overactive thyroid. The main hormone your thyroid makes includes triiodothyronine, T3, and thyroxine, the T4. Hyperthyroidism can affect your entire body and is a condition that needs to be treated by a healthcare provider. So, what is the differences between hyperthyroidism and hypothyroidism? Hyperthyroidism and hypothyroidism are medical conditions that both have to do with the amount of thyroid hormones thyroid and releases. The differences is how much. In the medical world, the prefix hypo means low or not enough. When you have hypothyroidism, your thyroid is underactive and doesn't make and release enough thyroid hormone that your body needs. So, what is the symptoms of hypothyroidism? The symptoms of hypothyroidism are a rapid heartbeat or palpitation, feeling shaky or nervous, weight loss, increased appetite, diarrhea and more frequent bowel movements, vision changes, thin, warm, and moist skin, menstrual changes, intolerance to heat and excessive sweating, sleep issues, swelling and enlarged thyroid, hair loss and changes in hair, texture, bulging of the eyes, and muscle weaknesses. So, what are the causes of hypothyroidism? Medical conditions and situations that can cause hyperthyroidism includes grave disease. In this disorder, your immune system attacks your thyroid. This makes your thyroids create too much thyroid hormones. Grave disease is the hereditary condition. If a family or a member has grave disease, there is a chance that others in the family could have it. It's more common in people assigned female at birth than people assigned male at birth. Graves' disease is the most common cause of hyperthyroidism, making up about 8.5% of cases. Thyroid nodules. A thyroid nodules is a lump of growth of cells in your thyroid glands. They can produce more hormones than your body needs. Thyroid nodules are rarely cancerous. Next is thyroiditis. Thyroiditis is an inflammation of your thyroid glands which may be painful or painless. It may happen within a year or of delivering a baby, or the postpartum thyroiditis. After you experience thyroiditis, your thyroid may be unable to recover, which would lead to hypothyroidism. Consuming excess iodine. If you're at risk for hyperthyroidism and consume too much iodine, it may cause your thyroid to produce more thyroid hormones. Iodine is a mineral that your thyroid uses to create thyroid hormones. Receiving intravenous iodinated contrast or iodine dye may also cause hyperthyroidism. Amiodarone, a medication that contains a high amount of iodine, may also cause hyperthyroidism. So the last disease that I will discuss is the goiter. So what is goiter? Goiter is a condition in which the thyroid gland grows larger. The thyroid gland is a small butterfly shape located in the neck below the Adam's apple. The thyroid gland produces the hormones thyroxine, also called T4, and triiodothyronine, also called T3. These hormones plays a role in a certain bodily function, including body temperature, mood, and excitability, pulse rate, digestion, and others. So, what causes goiter? Goiter has different causes depending on their types. The simple goiter develops when the thyroid gland does not make enough hormones to meet the body's need. The thyroid gland tries to make up for this shortage by growing larger. Then next is the endemic goiter. Occurs in people in certain parts of the world who do not get enough iodine in their diet. For instance, a lack of iodine in the diet is still a common problem in parts of Central Asia and Central Africa because iodine is added to table salt in the United States and other countries. These types of goiter usually does not occur in these countries. Sporadic goiters, in most cases, have no known cause. In some cases, certain drugs can cause this type of goiter. For example, the drug lithium, which is used to treat certain mental health conditions as well as their medical conditions, can cause these types of goiter. Other risk factor for goiter including the following is hereditary, inherit from the family, female gender, age over 40. This other diseases and condition can also cause us a goiter. This includes grave disease. Grave disease is an autoimmune disease. In this case, the immune system attacks the thyroid glands and the thyroid grows larger. Hashimoto's disease. This is another autoimmune disease. In this case, the disease causes inflammation of the thyroid glands. This causes it to produce fever thyroid hormones, resulting in a goiter. This type of goiter usually gets better on its own over time. The next is the nodular goiter. In this condition, goiter cause nodules occurs on one or both sides of the thyroid glands. Next is pregnancy. Human chorionic gonadotropin, a hormone that a human produces during pregnancy, can cause the thyroid to grow. Then, what are the symptoms of goiter? The main symptoms of goiter includes a swelling in front of the neck, just below the Adam's apple, a feeling of tightness in the throat area, hoarseness or scratchy voice, neck vein swelling, dizziness when the arms are raised above the head, and other common symptoms include difficult breathing or shortness of breath, cough, squeezing due to squeezing the windpipe, difficulty in swallowing, and some people who have goiter may also have hyperthyroidism or overactive thyroids. Symptoms of hyperthyroidism can include an increased resting pulse rate, rapid heartbeat, palpitation, diarrhea, nausea, vomiting, sweating, without exercise or increased room temperature, shaking, agitation, and some people with goiter may also have hypothyroidism or underactive thyroid. Symptoms of hypothyroidism can include fatigue, feeling tired, constipation, dry skin, weight gain, and menstrual irregularities. It's all about the endocrine disorders. And thank you and God bless.